Hello, and welcome to the Clinical Nursing Instructor Preparation online course. My name is Dr. Susan Knowles, and I'll be your host throughout the entire course. The course is really meant to be an introductory course for the beginning clinical nursing instructor. The overall purpose of this course is to improve nursing education by focusing on the development of clinical faculty through this orientation course, which includes a foundation of knowledge and teaching skills and strategies. The goal is that after completing this course, the novice instructor will feel prepared and confident that they are ready to facilitate student learning. The course focuses on the practical application of the information within the modules. Module 1 is called Transition to the Role of Clinical Nursing Instructor, and it presents a realistic picture of the transition process and the most effective clinical teaching behaviors for nursing instructors. Module 2 discusses the importance of the mentoring relationship. Module 3, the principles of teaching and learning, are discussed. This module is augmented by additional videos. Both the adult learning theory and constructionism are presented. In Module 4, this is where we talk about foundational issues. It talks about the principles related to clinical teaching such as ethics, trust, quality, and safety. Then in Module 5, planning and managing the clinical day is discussed. A supplemental clinical toolbox module with strategies for teaching is also available. Finally, Module 6 discusses the process of evaluating student performance, and it includes information regarding how to complete the student evaluation, as well as the importance of instructor documentation. And it also recommends that the novice instructor role play with their mentor for the delivery of the evaluation. Each of the modules will follow a very similar format. In addition to the audio lecture, there are recommended readings or participation assignments to ensure a deeper understanding. Several of the modules include an additional video or two. Finally, each participant will be asked to complete an evaluation of each module, preferably after discussing the module content with their mentor. Each participant will also be asked to complete a final evaluation of the entire course, but that's later. So what's different or special about this course? Besides the fact that it can be completed right from your own home over the internet, it's reflection and mentoring. A very important aspect about the clinical instructor course is that the participants reflect over the module content. Thought-provoking reflection and discussion questions are provided for each module. And there are no necessarily right or wrong answers to these questions. It's really important that the beginning instructor meet and discuss these questions and answers, as well as any other aspects of the content, with their mentor and coach. Because developing a mentor-mentee supportive relationship is what really makes the difference. The recommended textbook for this course is Clinical Teaching Strategies in Nursing by Gaberson, Orman, and Schellenbarger. I recommend you purchase your own copy of this extremely valuable text. It's available from Amazon or most bookstores. You may be able to borrow the text from the nursing department or the library. However, I really think that you'll be referring back to this text as you teach. The supplemental text I recommend is Fast Facts for the Clinical Nursing Instructor by Kahn and Stabler-Haas. It's a quick and easy resource, and it adds another perspective to clinical teaching. Some borrowed resources. I attended the Clinical Scholars course in Colorado at the Colorado Center of Nursing Excellence as a part of my research for developing this course. And I was given permission to use their materials, and I've incorporated two of the tools in this course, and they are the I Will card and the reflection log, which I've recreated and I've attached them to the course resources. And here's how they work. When you hear an idea that you think you will incorporate into your teaching plan, write it down in your I Will logbook. And this way you can go back and you can revisit the ideas when you need to. In the reflection log, I also included the reflection questions in the log already for you. Now, as you move through the module, you can answer the questions as you go along. Then revisit the material as needed to more fully record your thoughts. And remember, there's no right or wrong answer. And this is your opportunity to jot down your thoughts and then begin thinking about how you might handle these types of situations. Then make sure you go over your answers and your thoughts with your mentor. Here is where the two of you can brainstorm strategies that you might not have thought of yet. The references for each module will be attached at the end of the module. Obtaining feedback is extremely important, and that's why I'm asking you to do 3 things. First, register for the course. Second, complete an evaluation at the conclusion of each individual module and a comprehensive evaluation at the conclusion of the entire course. The final evaluation can be completed or is best completed after the final circle back meeting. And third, contact me with any questions. Also, I'm willing to be your coach. I want to make a personal thank you to you for your commitment of taking on this new opportunity because it's really important. Oh, and I forgot. Check out the presentation on why is the course necessary. It answers that question as well as what it takes to be successful in this course as well as a nursing clinical instructor. Thank you.